You are listening to The Summit, and as part of our Summit Focus Community Spotlight, we've been getting to know some of the Crystal Clinic doctors and some of the story behind what Crystal Clinic does. Today, Dr. Derek Cody, MD, Crystal Clinic plastic and reconstructive surgeon and breast reconstruction patient Lynn, both joining us. So welcome. Hi, Mr. Cody, Dr. Cody, and Lynn. Thanks for joining us here today.
Hi, Brad. Thanks for having us.
Yeah. Now, is Lynn joining you in your office? Is that right? She's a recent patient of yours?
Correct. Lynn and I are here in the office.
Excellent. Well, now before we hear Lynn's story, maybe you could give us your background and just a little bit of your backstory leading up to your position today with Crystal Clinic. So, Dr. Cody, what's your training and background?
Sure. So I am a board-certified plastic and reconstructive surgeon. I dedicate a large portion of my practice to caring for patients with comprehensive breast reconstruction surgeries. These include surgeries that involve implant-based operations and more advanced operations that include microsurgery. I graduated from the Ohio State College of Medicine, and my plastic surgery training was here at SUMA. I followed that up with a microsurgery fellowship in New York, and I spent some time on the West Coast before returning to Crystal Plastic Surgeons about 5.5 years ago.
Excellent. Well, we're happy that you're here in our own backyard. Tell us a little bit about Lynn and her breast cancer story and kind of how you worked with her.
Well, Lynn is here in the office, and she tells her story better than anyone.
Oh, okay. Well, let's have Lynn tell the story and how she came to to be working with you as a patient.
Hi, Brad. So I was diagnosed with breast cancer in the fall of 2017, and Dr. Cody came highly recommended by my breast surgeon as well as another plastic surgeon in the area. And so once I met with him based on my lifestyle, it was definitely recommended that I have a double mastectomy. I did not have a choice. But based on my lifestyle and my activity level and age and whatnot, I wanted to do whatever I could do to stay active and pretty much get back to myself. So Dr. Cody recommended what's called a deep flap, and I'll let him describe a little bit more about that. But so that's a more advanced surgery procedure.
And Lynn, when did this procedure take place for you?
So my surgery was November 14th, 2017 to be exact.
Gotcha. Yeah, and Dr. Cody, tell us just a little bit more about this particular case.
Yeah, so the deep flap is a type of breast reconstruction where I use a patient's own tissue to provide volume as well as skin in certain cases to perform the reconstruction. Because it uses the patient's own tissue, it's a more natural, warm appearing reconstruction while allowing patients to continue to maintain active, healthy lifestyles. The deep flap does require microsurgery, which is a form of transplant operation. So just like a kidney transplant where vessels are connected to provide blood flow to the new kidney, these flaps are reconnected to new blood vessels to provide circulation to them. Because this tissue came from Lynn's own body, she didn't require any medicines for rejection, but it is a transplant operation.
Gotcha. And if you're just joining us, our guest is Dr. Derek Cody with Crystal Clinic, the plastic and reconstructive surgeon, one of the surgeons with Crystal Clinic, and a patient of his, Lynn. Now, Dr. Cody, tell us also a little bit more about some other options or other new advances in some of the breast reconstruction available through Crystal Clinic.
Yeah, Brad, so at Crystal Clinic Plastic Surgeons, we really offer comprehensive breast reconstruction. That includes patients who are candidates for reshaping of the breast after a partial mastectomy. women who have enough breast tissue can sometimes reconfigure that tissue to provide a nice shape and form after a partial mastectomy, and that's called oncoplastic reconstruction. We're also experts at implant-based reconstruction, where an implant is placed into the surgical site to reshape and provide volume for the reconstruction. Implant reconstructions are very commonly performed throughout the country, and we have plenty of patients who do very well with an implant-based reconstruction. Some of the more advanced procedures include transplant operations like the DEEP flap, as well as the tug flap from the inner thigh. Also, the S-gap can be taken from the buttock as well. So we have these really advanced forms of operations that can really tailor reconstructions to different patients and different lifestyles. In addition to these advanced surgeries to reconstruct the breast, we also have some advanced options for patients who may be experiencing lymphedema after breast cancer and or lymph nodes being sampled from the arm area. And these surgeries can restore some of the lymphatics to help reduce the risk of lymphedema and some of the long-term complications associated with lymphedema.
Well, very good. And I have another question for Lynn. And this one, this is something that I think Lynn can speak to very well, having gone through the surgery and the whole experience. And that is, what's your advice for women who are facing breast cancer or considering breast reconstruction?
Well, Brad, it's a very personal decision. Every woman makes a choice whether or not to have reconstruction at all, and then after they choose to have reconstruction, they decide what type of procedure based on talking with their physician to see what their options are. So age, lifestyle, family, all of those factors tend to play a role into what they choose to do for the reconstruction, if they choose to do it at all.
Right. And then, maybe this is a question for both of you, but what are the benefits of going through the breast reconstruction surgery or the mastectomy surgery and so forth? Like, what have you kind of gained from the experience?
As I describe it, it's putting you, Dr. Cody literally put me back together again. You feel whole. You obviously want to look from the outside similar to what you did before, and then physically you want to be able to move around and do your activities and things. So from a physical appearance, and then obviously also internally you want to look and feel like yourself. Going through something like this is obviously life-altering, and so as quickly as you can get back to your normal function and get back to your life the way it was before the diagnosis is obviously very satisfying and well worth all of the time and effort.
Right.
Going through everything.
And Dr. Cody, do you have any thoughts to kind of, if someone's maybe a little bit hesitant? I mean, like Lynn said, it's a very personal decision.
Correct. It is a very personal decision, and I see patients throughout their journey through breast cancer and breast reconstruction. I see some patients that have immediate reconstruction and others that wish to delay their reconstruction for personal reasons or sometimes for medical reasons. So I would advise patients to really consider the option. We have a lot of great studies that have shown and benefit psychologically and emotionally and for well-being after breast reconstruction. And so we provide those options to patients so that they can feel whole again, get back to their lives as normal, and go on to have many years of survivorship. I would recommend that you research your plastic surgeon and just feel comfortable with them and the options that they provide you.
Well, absolutely. And I understand the main website is crystalplasticsurgeons.com. And Dr. Cody, if you want to also just give out that main phone number as well for more information.
330-668-4065.
That is the one. Yep, that's the main number, or like we said, crystalplasticsurgeons.com. So to our special guests here today for the Summit Focus, Dr. Derek Cody and his patient Lynn, we thank you very much for sharing your story and joining us today.
Thank you, Brett.